Thank you all for attending this evening. It is our honor and pleasure to present this workshop. Tonight we have two presenters who are going to give you information on setting up a disability-friendly vaccine clinic, how to work with various populations, those living with physical, cognitive, sensory, and mental health disabilities. And we have Joyce Turner, who's a nurse practitioner with Lela Pharmacy. And we have Antonio Martinez, who's a certified disability life coach and wellness and health coordinator for AACOG.
I am Joyce Turner, and I am a nurse practitioner. I am a community advocate, and I'm also an independent nurse contractor, and I work with Lela Pharmacy, and I want to welcome you to my mobile vaccine clinic. So what is a day in the life in my clinic? Well, you have to have agility because every time I go to a clinic, it's a different environment. So in this clinic, we don't have a table. So we adjust to the environment. We have our Band-Aids, our clipboard for the patient to complete the consent. I will fill out the COVID vaccine card using the clipboard. I have my gloves, blood pressure cuff, pulse oximeter, stethoscope. The vaccine has already been withdrawn. This is what I'm sitting the blue pad in to try to create some type of infection control and a stress ball. So here are our objectives. Okay, we want to understand the role of the nursing process in reducing barriers, develop empathy for the disability experience, review vaccine clinic best practices, understand the importance of training, and understand the importance of an accommodating environment. So what is a disability? According to the CDC, a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and interact with the world around them. The World Health Organization further defines the disabilities into three dimensions: impairment, activity limitation, and participation restrictions. Impairment. So when we think about impairment, we think about the person's body structure or function, right? Their mental functioning. For example, someone may lose a limb. They may lose their vision or have memory loss. There's also activity limitation, and when we think of that, it's trouble seeing, trouble hearing, walking, or just simple problem solving. And then with the participation restrictions, we think about normal daily activities. We take for granted participating in our activities of daily living. But for some people, that's difficult. A couple of dimensions of disabilities. So I clustered them, and we are not covering every disability, okay? So here we will focus on mental or brain, neurodevelopmental, and neurological. And I want to bring to your attention, we are moving away from mental health and referring to it as brain health because there's a stigmatism with mental health. And we want people to feel comfortable getting help. The same way if you have diabetes, it's not a secret. I have diabetes and I'm going to get my insulin, but you don't hear people saying, I'm bipolar and I need to pick up my medication so that I can function. So when we look at this category, we have some specific things that we want to consider. First of all, we need to understand some of the conditions that fall within the categories, right? So we think about post-traumatic stress, anxiety, depression, schizophrenia, bipolar. Someone just may simply have a fear of needles. When we think about neurodevelopmental conditions, we think of things such as Asperger's or autism spectrum disorder, which Asperger's is a part of the autism spectrum, but they are no longer using that term. We think about attention deficit disorder, intellectual developmental disorders, learning disabilities. You may have, when you think of neurological, you may think of a traumatic brain injury or fetal alcohol syndrome. So I need to tell you how I applied the nursing process in my own clinic. So one day I was doing a clinic at a school, and I noticed that there was a child in line, and his parents took a poster and put it around him. Well, when it was his turn to come to my chair, he ran to a room. So I walked behind them. And so I went into the room and I realized this child is in sensory overload. The child happened to have autism. And when you experience sensory overload, you have so much input that your mind shuts down and you can't think. So sometimes people respond with their behavior. So for that child, he ran. So I sat on the floor to meet the child at eye level. The parents were talking and trying to convince him to get the vaccine, and the school nurse. And I just respectfully said, okay, I need everyone to take 2 steps back. And let's just have silence. And then I spoke to the child. I understand that he would not look at me because I understood his condition. So I used my hands and I said, look at my hands and just breathe with me. Take a deep breath in and a deep breath out. I was not able to vaccinate that child that day, but there was still a success. He did not run out of the room. He walked. We developed trust. But what did I learn? I needed to apply my nursing process. I knew that if I happened to have someone with a person with a disability, I knew what I would do once they were in the chair, but I didn't think about what happens before they're there. They're standing in this long line, and then when they get up to you for the vaccine, they may have anxiety, they may have trouble breathing, or various other conditions. So I had to look at my data, okay, and I had to implement a nursing diagnosis. So in the case of this particular patient, there was the sensory input was too great, right? There was a risk for disturbed sensory perception. So I did see the unexpected findings because I had not implemented the nursing process. The child was covering his eyes, he ran. But I adjusted, I applied agility. And so what we did was I trained everyone on my team to help me. So we notified the school nurse before the clinic, and it's actually the associate superintendent. So he would notify the school nurse and the principal. Okay, if we have any child or adult, any person with a disability, they go to the front of the line, okay? And we designated a person to vaccinate the person, and that person was me. So we had to adjust our environment to accommodate the needs of our patient. So let's just go over some general things for this category. You want to avoid perfume, cologne, and other scents. You've probably heard that before. You want to ask someone before touching them, especially in this arena of disabilities. You don't just go touch someone, you ask permission. You want to adapt to the patient coping response. So for example, with autism, children stim. So they're moving. That's their coping skill. Or you may have a child that's using the headphones. Okay, they may be playing with the tablet or the phone. But what we don't want to do is physical coercion. We don't want to do that. So one day I had a child that was stimming. He was nonverbal. He was on the autism spectrum. So he was autistic. And we had to give him his vaccine. Again, we had to be agile. There was no talking to him. So I, at first, had the needle and I was going to administer the vaccine. But we had to change the plan. So I stepped away. I went to get one of my colleagues and I gave him the needle. So I had it behind my back and then he took the needle. So the mother and I, we had to safely secure the child. He was standing. When you safely secure a child or an adult, it does not involve the neck, okay? So the mother hugged him, and I just made sure his legs didn't allow him to run. And so we were successfully able to vaccinate him, but when he came back for the second dose, he did not go to my designated area where it was quiet. He's like, I'm not going past the registration table. So they came to get me. We met him where he was, and we vaccinated him. It wasn't as much effort needed, but we still had to stabilize him, and we still needed a second person to do the vaccine. Now, you may want to have fidgets available, again, a designated area, and the deep breathing exercises. Another category, visual, hearing, and communication. So some examples would be blindness, glaucoma, hard of hearing, social pragmatic communication disorder. So social pragmatic communication disorder, people get that confused with autism, but the difference is with the social pragmatic communication disorder, it's just a problem with communicating. You don't see the repetitive behavior associated with the autism spectrum disorder. In this case, I want to give this example. I was doing the vaccines, and about 5 patients later, I noticed someone was still sitting there with the clipboard. So the nurse and me assessed, well, maybe this patient cannot read or write. So I had to come up with a way to avoid embarrassing the patient. So I said, the writing on this paper is so small. Do you need help? And so I helped that patient without what? I did not embarrass the patient because it is possible that the words may be too small. So you want to consider these things. Here are some very important pearls, okay, associated with this category. You need to identify yourself and your role. Imagine if you could not see and someone just walks up to you and they start touching you. They don't say anything, but the person can see you, right? You want to describe what you're doing. Be specific. If it's okay with you, I am going to touch your right arm. I will wipe you with alcohol. It may feel a little cool. I'm going to give it a minute to dry, and then I will put on your Band-Aid. That's one method I have. I find my site. I put the Band-Aid on halfway, and then I give my injection, and I just want to remind you of something. Take your finger and try to go from here and press your arm from a distance, okay? Now I want you to get really close and press it. Did you feel the difference? It wasn't as forceful. So when you have a needle and it's, 2 inches away from the arm and you dart it, that's painful. So try to work on your technique. We don't want to traumatize the patient, okay? Now, in the ideal world, we would use a clear mask, because when you are helping patients who are hard of hearing or a person that may be deaf, they need to see your mouth to be able to talk. But that's in the ideal world. In my mobile clinic, I don't have that. So I will use pen and paper. Sometimes there is an interpreter, which is a family member, but we don't have any idea who's coming to the mobile clinic because it's not by an appointment. You just arrive. So oftentimes we use paper and pen. We read forms for people. It may be that the person has a vision impairment. They may be blind, or maybe they cannot read or write. We have another category, and this is physical chronic conditions, progressive and intermittent conditions, right? So we think of things such as a person that's wheelchair bound. They may have limited mobility, which may require a walker or a cane. They may have lost a limb. Maybe they have a spinal cord injury. They may have chronic obstructive pulmonary disease, right? And that will interfere with their ability to what? Breathe, right? They may have asthma, emphysema, diabetes. Okay, they may have multiple sclerosis. And when you think of that condition, it's intermittent. Sometimes it's a problem, and sometimes it's not. But you know what? We need to ask people if they want help, right? Because they may not want help. Sometimes the person that comes in with the wheelchair, you ask, may I push your wheelchair? No, I have it. And don't forget about the patient with the walker, the rolling walker with the seat on it. Do not touch the walker, okay? Because they want to use their walker and they use their seat. So you don't want to assume that people are incapable of doing something just because they happen to have a disability. So I was at a church, and there was a patient. Again, I'm going to tell you how I applied the nursing process. There was a patient who was on oxygen, and someone from the team, they came to tell me about it. So I did not want that person to get out the car. So again, I had to do what? I had to assess the situation, okay, come up with a nursing diagnosis. One of them is activity intolerance, right? That person can't walk up to the top of the auditorium, okay? And I had to come up with a plan. So I went to the car. I went to the car to do the vaccination. And more patients started coming. So then I was able to evaluate that the implementation or the intervention did in fact work. Okay. Sometimes you have to do a home visit. I have gone to houses of hospice patients. Again, you want to designate an area. If someone has activity intolerance, they may be short of breath. You want to consider having an area that's close enough for those patients who do not want to wait in the car. For some people, it's their independence. They still want to try. And that's okay. We have some basic things that we need to remember when we consider disabilities, and even for the person that's not disabled. There are just some basic things that we need to do. We need to avoid stereotyping. Do not have a bias. When you have met one person with a particular disability, you have met that one person. Do not assume that the things you needed to do for that person or the way that person responded or the behaviors of that person is universal. Again, you need to use your nursing process. And we need to recognize these are people like me and you. And you know what? They have feelings. And you want to respect that. You have heard me say a person with a disability. It's a person. It's not the person who's crippled. It's not that. It's a person who has a disability. In other words, you don't identify the person as diabetes. Come over here, diabetes. That's not appropriate. First of all, you would use the patient's name, regardless of if they have a disability or not. So people have disabilities, right? But they are not the disability. The disability does not define the person. And again, as I said, patients are people first. You want to explain the medical terms and the actions. Don't assume that people, everybody may not understand that when you're saying SOB or when you're saying ADL, that you mean short of breath or activities of daily living. You need to explain to the patient in the language they understand, okay? And you want to use the appropriate language and tone. You don't want to speak to an adult, a teenager, or a child as if they were a 2-year-old. So don't use that tone. Don't sing to the patient. The patients really don't appreciate that. So just try to keep those things in mind. Sometimes you're trying to do a good thing and you don't realize you're actually causing more harm. Okay, so we're in clinic today and I have my patient and my patient's caretaker, okay? This is just basic disability etiquette. I told you already, right, that I need you to feel comfortable asking someone if they need help. But I also need you to be okay with the fact they may say no, and that's okay. So you need to respect that. You want to respect the person's personal space. Again, you want to ask, is it okay if I touch you? So in that case, I would not. Okay? It's their personal space. Now, you may wonder, well, how will you give a vaccine? Well, I'm going to talk to the person and offer them an opportunity to understand. And I'll come back to an example of that in just a moment. You need to respect the service and emotional support animals, okay? They're not pets for you to touch and play with. They are there for a purpose to help the person that happens to have a disability. We want to speak to the patient directly. Hi, why are you here today?
To get a vaccine.
Okay. Instead of, hi, I'm here to talk about Jane. What's going on with her today? How is she feeling? Well, the patient is Jane, not the caretaker. So do not disregard the person, the patient. You want to talk to people at eye level. okay? So I'm not going to talk to my patient like this. I'm going to bend down a little bit. Ideally, in a vaccine setting, you're both seated in a chair. But this is just something that you want to consider. I want you to know you need to treat people the way you want to be treated. Never forget that in your nursing career. Treat people the way you want to be treated, even if it takes extra time. Okay? Now, it's very important to also remember this, that sometimes you have to watch how fast or slow you're speaking. You have to pay attention to if the patient can deal with eye contact. Some patients, they will not look at you. Most people perceive that as rude. Well, actually, maybe that person just cannot tolerate eye contact. You think of that especially with the autism spectrum disorder. So remember the child that I said I did the breathing exercises with? Remember, I didn't say that I looked at him because I noticed he was looking down. So therefore, we weren't going to have eye contact. But a lot of times, those children or the adults, they can tell you everything you did, what you said, how you were moving, and what you have on. So don't assume that they are not paying attention, because actually they are. So I want to say thank you for my patient and the caretaker coming to my clinic. Thank you so much. So we are going to do an exercise. And in this exercise, I want you to have the experience of someone with a disability. The fuzziness, the confusion of the maze of contention, the chirps and the screeches, sucking cognition like leeches, little by little, weighing you down till you explode. It's called overload. What I go through each day, no matter what I do, no matter what way I try to go by, expecting the unexpected, so I jump. There's no method perfected to stop the pain. Like a jolt of electricity trying to get into my brain. Through my ears, that's what I get when all these sounds I hear. The sounds you ignore that most can filter out. To me, a whisper can sometimes sound like a shout, especially when there are hundreds of whispers all around, millions of different types of sounds, all at the same time without a rhyme, just a mumbo jumbo of all sounds all around. Nowhere to escape, not knowing when the final blow will go and knock you off the rim. And when you explode and have a complete overload. So now I need you to look into your folder. And there's an activity. Okay? So the activity, do you see it? The purpose of this exercise was for you to get an idea of what it feels like to have sensory issues. The sensory issues just happen to be part of the autism spectrum disorder. And those symptoms can range from very mild to severe. They can be mild one day and more severe the next day as they build up. The statement is from L. Dawn Z. She has a condition called Asperger's syndrome, which is considered a milder form of autism. And she was the author of the poem that I read, Sensory Overload. So today, we have talked about breaking barriers at vaccination clinics. So we want to remember to utilize the nursing process. We want to increase disability awareness by incorporating vaccine clinic best practices. The handout is in your folder. We want to adjust our environment, and we want to train members of our vaccine clinic team. Thank you for your attention.
So next up, we have Antonio Martinez, who's the Health and Wellness Coordinator for AACOG, which is Alamo Area Council on Governments. And he is also a certified disabilities life coach. AACOG works primarily with individuals with intellectual and developmental disabilities, as well as older adult populations. Antonio?
So good afternoon, everybody. Thank you for coming out. So yeah, those of you that have not heard about AACOG, we are a council of governments. In the department I work for, we are the kind of the gatekeepers and the monitors of persons with IDD receiving services through the state. So we monitor those providers that are giving those services. We monitor the individual and their families to make sure everything's going according to Texas Administrative Code, and we report it to Health and Human Services. So I want to start off by saying that, I know there's some curiosity, why is there such a big push for this? Why is there this being shed on, light? In 2017, the city of San Antonio did a quick survey, and they found back in 2017, there was about 59,000 people here in San Antonio with a hearing disability, 74,000 with a vision disability, and 89,000 with a cognitive disability. So you can imagine the influx we've gotten now with a lot of people moving out of state here. That number has increased. And not to mention, persons with IDD are now starting to live 80 years of age instead of 50 to 60 years. So we come upon this, and one of the biggest barriers we saw when COVID vaccines were being offered to the public is that a lot of persons with IDD were not vaccinated in the very beginning. And it's not that they did not want to become vaccinated. Actually, they were twice as likely willing to become vaccinated than persons without disabilities. But the barrier was accessing the vaccine sites. A lot of it was done through technology. There was kind of that, as Joyce had described it, that sensory overload. Can you imagine somebody who doesn't want to take car rides having to go through a drive-through and maybe waiting in those long lines that we saw through the Alamo Dome? Is that very comfortable for them? So those are the barriers that we kind of started to see, and we wanted to address. The program that I came out with is providing transportation to these sites. Why did I go this route? Well, it's because I knew a counterpart to us called Disability Rights Texas was providing in-home vaccinations. So I wanted to make sure that if I were to write a grant and receive it, I was being all-inclusive. I was making sure that one end was covered, and then I was covering the other end and providing that service. So with that program, we were providing door-to-door transportation. We were scheduling the follow-up appointment, making sure they were available. They didn't have to worry about the technology. As it is, my parents already struggle day to day with technology. I can imagine trying to navigate a health site that has all these confusing words to just reschedule a second vaccine or even a first vaccine. Another thing we did is we made sure that the transportation also had wheelchair accessible vehicles. We also made sure that if a person did need to travel with somebody and a caregiver was not available, that they had a caregiver who was well versed in working with persons with IDD. So we offered that to make sure if they needed a companion just to ride with and to say, hey, you know what? You're about to get a vaccine. We're going to stand here in this line for this long. This is what's going to happen. Kind of walk them through it. That was available for them, and it still is. Sometimes we would assist persons that were here in Bexar County go through the Metro Health lines because they were the ones offering the HEB gift cards. But on the end of it, persons were coming back and say, hey, you know what? They didn't help me fill this out, the form to get it. How are we really assisting? And that's something as healthcare providers and professionals that we really need to consider, is that we're being all-inclusive and addressing these barriers. One of the biggest ones we had when all this started is, how do we really know that a person with IDD really wants the vaccine if they don't communicate with words? What happens if they're their own guardian? And we have persons that we serve like that, who are what the typical term is nonverbal, but we say persons who don't communicate with words. How do we distinguish that? Well, I don't know if you've heard of the 55-38% 7 rule. 55% of communication is done through nonverbal body gestures. 38% is done through vocal. You know, your significant other, your partner, your friend, they tell you something, you're like, That's the vocal part. And 7% of communication is done through words. So how did we make sure that if a person that did not communicate with words wanted the vaccine? We asked them. We had somebody in the room that had developed a relationship with this person for years to help us make that determination. And it was a team meeting that we had just to determine this. And to take it a step further, another barrier is, how do you know which one they wanted? You know, we have that division amongst ourselves that, oh, you took the Johnson one. Oh, you took the Pfizer one. How were we making sure that they got the ones that they wanted? If they just wanted the one-time shot. Or that they were fine and they wanted to come back for the second time because they had somebody like Joyce that understood them. It's having those meetings and really addressing those barriers. And I know it takes a little bit more time. And I know in this day and age, we've kind of McDonaldized our processes. We've gone through that quickness. But I'm pretty sure at some point, you know, our parents, as we get older, we are going to want healthcare professionals that can really take the time with us. So it's not that regardless if a person has a disability, it's just the right thing to do. To really take the time to listen. And in serving and advocating for persons with IDD, one of the promises is listening through person-centered practices. We got to make sure that we don't get mixed up in all our abbreviations, the medical terminology. We want to make sure we speak clearly in very simple terms. We really want to avoid metaphors. I've heard health professionals say this is going to sting kind of like a bee. Well, I didn't purposely go get stung by a bee prior to my vaccination to really make that connection. So you really need to speak clearly to them. Another thing we saw with barriers is a lot of printed material. It came out very quickly, which was great. But a lot of it was used in terminology that was a little hard to understand. So we need to consider other forms of writing, like plain language. Especially right now, since we shifted towards technology and we've adapted these Zoom meetings and Skype meetings. We have to make sure that persons that are on the other end and you're presenting such things, that assistive technology can actually read the PowerPoint or the flyer. I've discovered and I've witnessed firsthand that, despite the barrier that a lot of the persons we serve have a hard time reading, they know about these things, these phones. And I've noted every flyer that I put out, I put a QR code on it. And even though they can't read everything that's on a contract or anything or on the flyer, they know how to access that QR code. And a lot of my QR codes go to the flyer. If it's a flyer in English, it'll explain the program in English. If it's a flyer in Spanish, it'll explain the flyer in Spanish. That has gone a long way, and I've seen it, which was great. We also got to be considered, one thing is with the vaccine clinics and working with persons with IDD that come through your clinics or whatever setting you're in, is that sometimes they may come in in a bad mood. And right away, you don't want to say that's a behavior. You really don't. We all have our routines, regardless if you have a disability or not. You wake up in the morning, maybe you take your time getting ready, you have your coffee, you have your breakfast, you don't have breakfast, you get stuck in bad traffic, Pandora is probably not playing the songs you want, but your parents or your spouse or your partner don't come up and tell you, hey, you know what, you're having a behavior. I'm going to have to put you on a plan to make sure this is addressed. You're just having a bad day. So you want to make sure that even if it's not, even though they might be upset while they're getting this vaccine, it's nothing personal. It's not them having a behavior. It's probably just their routine that's been interrupted. Just like we all have our routines. I strongly encourage healthcare professionals to really look up this modality that the Multi-Assistance Center is trying out, the MAC Center. If you haven't heard of that, it's a large center being built next to Morgan's Wonderland that is going to be a one-stop shop for persons with IDD to see all their physicians. Instead of traveling all over San Antonio and fighting traffic, they've adopted this concept called practice without pressure, which was kind of developed in northeastern states, I want to say in Delaware. And it's an amazing way to really practice and really have families buy into it. Have them practice with whoever they're caring for, those caregivers to practice. And it makes your guys' job a lot easier. When they come into the office, things flow a lot smoother. Kind of like Joyce said sometimes, maybe you don't get it at that first try, and that's okay. But you keep doing it, and eventually they build that trust and rapport with you. Also, one of the things we really want to consider is that we make this push that we really are cognizant about cultural, this culture and that culture. There has been a shift that disabilities are no longer just a disability. Deaf culture kind of led the way in this, that they considered it a culture, and they are a culture. It really is. Autism took that next step, and now they're considering themselves a culture. And now when we speak to persons with IDD, we call it the IDD community, because they are our culture. When I first came into this field, I knew a little bit about deaf culture. I knew a little bit about persons with IDD. I didn't know anything about blind or low vision. So I went and I asked. Because I don't know. I don't want to impede on a person's independence. So I strongly suggest that if you are unaware or just really want to learn more, reach out to, there's AACOG, there is San Antonio Lighthouse for the Blind, there's the ARC of San Antonio. There are so many organizations out there that are willing to help and teach you about this culture. And that's what we're there for. In vaccinating persons with IDD, please consider their preference. Ask them, do you want it on the left or right arm? I don't think, is it going to make a difference, Joy? No, okay. You really want to make sure is the drive-through suitable for them. Of course, you don't want to have somebody stuck in a car, especially during this summer. Sometimes medications react differently with heat. And that tends to happen with the persons that we serve. Also consider the setting that you're taking them into. You don't want to take them into the high hour of HEB traffic and there's so much sensory overload. They may have come into your office kind of still, but if you're in an open setting, they see a lot of commotion going on and they start stemming, you really need to slow it down, take your time, talk to them. Don't rush. Make sure that the vaccine is not a long process. And like Joyce said, just because a certain way has worked with a person with a certain disability does not mean that same particular way that you worked with that person will work with a different person with that disability, if that came out correctly. Up in the front at the table, DisABILITYsa formed a kind of a picture booklet. A lot of us are visual learners. That booklet will go a long way to really assist the persons that you treat on visualizing, hey, this is what's going to happen. This is what the nurse is going to do with me. This is the office setting I'm going into. Using those pictures creates a visual cue for them. And make sure you include everybody in the conversation. Even if the guardian is there, the LAR, the parent, make sure you're talking to them as a whole, as a family. I used to work at the juvenile courts and in the school districts with special education. And many times the child was left out. Even though the child was the one that we were creating the IEP for, or the conditions of the court were written for. If you don't include them, then how are you really serving them? But please, it's all about inclusion, you guys. And should you have any questions, feel free to reach out to me, AACOG, and any other resource that's out there. Thank you.
I thought the mic was on. I want to thank our presenters this evening. Just wonderful, detailed, comprehensive information that in summary captures be informed, right? So take your disability sensitivity training or your disability confidence training and bring it back to your clinics and your colleagues and your fellow students. Learn what person-centered care means. Learn what people-first language is and bring that into your practice. Assess and be observant. So notice things around you so that you can help not only yourselves but your colleagues identify people who might need that extra time, that extra attention, or that accommodation. Be adaptable. Communicate clearly. We learned this evening that there are several formats for communicating. Pictorial. We have the resources of a communication board, right? So that people can point to pictures that they identify with to communicate with you Joyce talked about pen and paper, but you can also use the point and touch to get that information across. We have the social story that walks you through in a pictorial format about getting a vaccine. We have ASL videos that help explain what the vaccine choices are, what to expect when you're getting a vaccine, as well as several other resources. So on the back of your agenda is a list of resources with links to ASL videos that go into full explanation about getting the vaccine. Plain language, we learned how important that is for all of our informational and instruction materials. We learned that we need to listen and ask questions, that we can't make assumptions because every person with a disability is a different person from another disability. Again, there's lots of tools and resources, not only to help guide you in your practices at the clinics, but also that you can make available for the people with disabilities that you're serving, right? Information about transportation options or childcare, or the Disability Information Access Line that can help your patients have a more successful experience. And we'd like to thank our sponsors. So our program is funded through the Texas A&M Health and the State of Texas Department of Health and Human Services. It's made possible through our partnerships and collaborations with Alamo College District, St. Philip's College, the AACOG, and Texas A&M San Antonio. And for our partnership here at St. Philip's, we'd really like to thank the St. Philip's College MLK campus for hosting us, as well as the St. Philip's College Nursing Education Department. We really appreciate this opportunity. We do have a few media sponsors that helped get the word out about these events, and so we'd like to recognize them. And with that, we conclude our program for this evening. And so you're free to go. We've gone a little bit over time, but if you do have a question, are y'all okay to stay just a few more minutes? We can entertain those at this time.